It's 8:41 here on this Sunday morning, a condition that 18 million Americans are living with right now.
Obstructive sleep apnea that can really ruin a good night's sleep and then, of course, your day after that. It's a disorder where your breathing starts and stops repeatedly. And Dr. Gendron with Midwest Ear, Nose, and Throat Specialist is here to talk about a treatment. Okay, so talk to me about this because I know people with sleep apnea. We probably all do.
Yeah.
It's so common. But what exactly happens when they're sleeping then?
So while people are sleeping when they have obstructive sleep apnea, their muscles in their airway relax. So the back of their tongue collapses back toward the back of their throat as well as their soft palate. And it actually keeps them from breathing or really diminishes how much they're able to breathe while they're sleeping. And then because they're not breathing well, they have these arousals and they wake up just a little bit so that it opens up those muscles again. But then that obviously disturbs their sleep, and that happens many, many times while they're sleeping.
And a lot of people might think of it as, their partner snoring. Oh gosh, it's annoying, but they may not be breathing. It's much more serious than that.
Correct, yeah. Bed partners describe patients actually holding their breath, and it can be for pretty long periods of time.
So talk to us about, it's called Inspire therapy. What is it and how does it work?
So Inspire is a new implantable device that we have available. And basically there's this small part of the device essentially, and that is implanted basically under the skin over the chest wall. And then there is a sensing lead that goes between the ribs, so it tells the device when patients are trying to breathe. And when patients are trying to breathe, there's a separate wire that stimulates a nerve in the throat that basically opens up the throat so that they're able to breathe.
You've got it in your hand right there. It's pretty small. So that's what's implanted or no?
It's this along with these very, very fine wires that come off of it that sense breathing and then stimulate the nerve that it needs to stimulate.
It's like a pacemaker.
It's exactly like a pacemaker.
Much different from those machines that we have seen forever for people using and that they complain about that are kind of obtrusive when you're trying to sleep.
Correct. Very different, much more tolerable for patients, generally speaking.
Okay, so if folks want to get in touch with you and maybe try this out, maybe it works for them, how do they do that?
They can visit the inspiresleep.com website, and that goes over indications. This is really only good for the minority of sleep apnea patients. It's for patients with moderate to severe sleep apnea and a body mass index of 32 or less.
Okay. Interesting. Kristen, thank you so much. You can learn all about sleep apnea and a seminar that's coming up later on this month by visiting our website. Find out how you can get registered. Just go to our links page at KSTP.com. We've got lots more information for you right there.